China is ramping up efforts to neutralize the coronavirus with another weapon added to an arsenal of border curbs, mass testing and hard lockdowns: anal swabs. While there is no nationwide policy on use of the technique, some residents in China's northern regions have been subjected to the anal swabs with little warning. It involves the insertion of a saline-soaked cotton swab about 2 to 3 centimeters into the anus, with the sample then tested for active traces of the virus. According to local officials, more than 1,000 school children and teachers in Beijing were given anal, throat and nose swabs last week, along with a separate antibody test after one asymptomatic virus case was detected on campus. In a state televised interview, Li Tongzheng, Deputy Director of the Respiratory and Infectious Disease Department of Beijing Yuan Hospital, said, "The use of the new detection technique is based on research that traces of the virus found in the anus can last longer than in the respiratory tract." He said that anal swabs could be more accurate than throat and nose tests, adding it was only being used on at-risk groups, including at quarantine sites. Scientists have found that some COVID-19 patients have active and prolonged gut viral infection even if they don't manifest gastrointestinal symptoms. For such people, stool samples often test positive even a week after their respiratory samples have gone negative, researchers from the Chinese University of Hong Kong found. Still, there is no evidence that virus transmission is any more common among patients who test positive in the anus area, and anal swabbing has not been conducted in other places that have successfully achieved near elimination of the pathogen, like New Zealand. While Western nations like the US and UK still struggle with adequate virus testing, China is not just testing entire city populations every week, but also millions of frozen food imports and the containers that arrive in every day for minute traces of the pathogen. All incoming travelers are subject to multiple tests and lengthy quarantines.